Hey everyone, so Module 6, we are going to go over nursing theory. What are nursing theories and why are they important to evidence-based projects? So objectives: define the theory, meta-paradigm, and concepts as related to nursing, distinguishing between conceptual and operational definitions, and describing how theory and research influence each other in a professional discipline, and exploring various middle range theories. So what is a theory? A theory is a set of concepts linked through propositions to provide an explanation of a phenomenon. Nursing theory is a belief system that guides practice, providing a lens through which nurses view patients. So nursing theories explain, describe, predict, and prescribe the nursing care that we give. So what is a meta-paradigm? A meta-paradigm is a way of looking at things, a way of organizing those concepts and reasoning. A paradigm is an overarching umbrella of values and beliefs. So it can shift based on age, experience, and new discoveries. For example, the overall paradigm that was the world was flat, and then the astrologers and the adventurers proved that you could sail around the world and not fall off, then guess what? We had a new paradigm. Another example in relation to nursing was Florence Nightingale, right? So her hand washing. So she, right beforehand, there was no infection control. And with her thought and theory on hand washing, then we created a new paradigm, a new way of thinking. Okay? A paradigm is a uniting set of concepts that are held to be true. And we're going to go over this picture over here on the next slide. So elements of the meta-paradigm. So we've got your human being, the environment, the health, and nursing. So the human being. So who is this? This is the patients. These are the people that we're taking care of. Are they capable of interaction, of adaptation, of growth? Are human beings more than the sum of their parts? Okay, it's those big thinking questions. For the environment, what constitutes the context in which human beings live and function? Is the environment internal or external? Who can manipulate the environment? What does the environment have to do with health? So the environment, right, is external. So that's for our patients when we're in the hospital. It's the hospital, the environment that they're in, right? Which is why we're constantly changing our environment, right? We might be in the hospital, but we are changing what our rooms look like and how we provide the information we give. So all of those things are manipulating the environment. What does the environment have to do with health, right? Everything, right? Health. So what is health? What does it have to do with sickness and chronic problems, potential for growth? What can be done to move toward health? Is it individual or communal or both? Then nursing. What is the role of the nurse when interacting with a human being? Is it to care for or work with? Are we providing or facilitating? Are we stepping in or are we going to empower? Right? Who can be a nurse? What does it take? So for example, as our care, as we are moving forward and developing new thoughts and new paradigms, right? So we are realizing that in order for someone to change their behavior, we have to engage them, right? We have to make sure that they are as much a part of the process as we are as nurses. Who can be a nurse? What does it take? What place does nursing have in these spaces? All of this are elements of the meta-paradigm. So what are concepts? Concepts are individual building blocks joined together by statements to create propositions or statements about the relationship between two or more concepts. So conceptual definition. So what does conceptual mean? It's a definition of the concepts contained in the theory that's being used. So it's the concepts that are within that theory. Then your operational definition explicitly states how the variable will be measured in the research study, right? The operational is how it's going to operate. How is it going to look? How is it going to work? The conceptual is that overall theory of the overall concepts. So, what are grand nursing theories? These are abstract nursing theories. So, they encompass actions, patient responses, and healthcare outcomes in multiple settings. Okay, so examples of these is the adaptation model, the self-care deficit theory of nursing, the science of unitary human beings, and the theory of goal attainment. So, taking a look at we'll do the adaptation model because it's the easiest. So, this is Roy's adaptation model of nursing. And it views individuals as adaptable systems interacting with their environment to maintain their health. Okay? So it's emphasizing that individuals respond to the stimuli in their environment through various coping mechanisms to maintain all of their social, physiological, psychological, okay? So this is a grand nursing theory. It's not specific. It can be applicable to so many different, it can be applicable to nursing, really, in general. Okay? So, self-care theory deficit. So, this theory was developed by Dorothea Oram. So it's basically that individuals are capable of caring for themselves to maintain their health. But when they cannot due to limitations, they experience a self-care deficit requiring our assistance as nurses. Okay, so this theory is emphasizing patient independence and empowering individuals to manage their health effectively. Okay, so again, right, this is applicable to nursing as a whole. Okay. Then we get to middle range theories. So these are a little bit more specific. They might not be applicable to everything in nursing that we do, but they're still very applicable to the majority of your projects. So these middle range theories are less abstract. They describe specific experiences like comfort, okay? The comfort theory, the caring theory by Watson, uncertainty in acute or chronic illnesses, and self-transcendence as a person ages. So all of these are examples of middle range theory. So Gene Watson's theory. So emphasizes the importance of interpersonal relationships and the role of the nurse in promoting health, humanity, and well-being. Okay, so compassion, dignity, love, being authentic in our practice, all of those things are those moments, those caring moments. Okay, so not all aspects of nursing necessarily have the promotion of health or the promotion of well-being or interpersonal relationships. There's so many different varieties of nursing, okay? So that's why it's not necessarily considered a grand theory. Okay? And the same with all of these. We're not going to go over all of them. So this link here, to nursing theories. So nursing theories, right, there's a lot of them. But basically, your goal for this week is determining determining two theories that you think would be applicable to your evidence-based practice project. Okay, so this link will take you to the nursing theory .org. It will take you to these theories and models that are listed, and they're listed for you under overarching terms. So it's really very helpful. So there's adult nursing, public health or community nursing, family nursing, critical care nursing, perinatal nursing, holistic nursing, pediatric nursing, neonatal intensive care nursing, and it list goes on and on. Home health, psychiatric. Okay, so the theories are listed what is applicable under those areas of nursing. You are going to, again, choose two of those. So I'll go to the next page. You're going to write a paper for me for next week. So this is the nursing theory comparison paper. And these are the directions. Okay. So the purpose of this assignment is to explore nursing theories and determine which is the most applicable to the group's project. So the goal is to compare two theories and explain how they will help guide your evidence-based project. So theories are not new to you. So pick two theories that you think can be of a conceptual model for your project. They might be the Watson's caring theory. Okay. They might be a theory of change. They might be the theory of interpersonal relations. Okay. So you're going to take those theories and you're going to do your research of those theories. You can utilize the web pages. This nursingtheory.org is a part of the ANA, so it's reliable, right? You can use those to understand more about your theories and do a little bit of research. And then you're going to tell me how it's applicable to your project. So tell me about the theory and then how it's going to be applicable to your project. You will place this in your final paper. So this should include a title page and 1 to 2 pages in length, not including your references. As for references, you should at least have two references, okay? And please if you use a web-based page, please reference that as well when you're looking up your theories, okay? And obviously, if you have any questions, please shoot me an email so I know I can help answer your question. Okay, but this is individual. It is not a group. It's not group work this week. Individual. Everyone will have their own comparison theory. You may talk about it as a group to decide, which one do you think is the most appropriate, but you will each write your own paper. Okay?